And I think now that we actually look at it differently and think about it, those are that's what fuels that perception that men have. I think I'll pick up on anger because I think that is it is the go-to for men. Yes. It's what they tend to hide behind. I'll just show I'm angry and everybody will keep away from me. Everybody will retreat, Assalamu alaikum, everyone, and welcome back to our podcast series titled Crucial Conversations. My name is Sukaina Takim. I'm a clinical psychologist and mental health counselor, and your host for this podcast series. On our final episode today in the series, it is my absolute pleasure to welcome Dr. Irfan Jaffer, a general physician, the co-owner of Zainabia Polyclinic in Dar es Salaam. He has been practicing medicine for 8 years, and he's also involved in an aesthetic and weight loss clinic in Masaki. Karibu sana, Dr. Irfan. It's a pleasure to have you with us today.
Thank you. It's a pleasure to be here. Thank you so much.
Wonderful. Okay. Our topic today, an interesting one for a very important demographic, men and how they perceive mental health and emotional regulation. And together with Dr. Irfan's experience, expertise, I hope we're able to decipher men's mental health, its importance, and bust some of those myths that surround seeking help. Okay, Dr. Irfan.
Thank you so much. Yeah.
Let's jump straight into it. So the statistic is showing it's 1 in 4 men who will have a mental health challenge at some point in their life.
Yes.
What's the word on the ground? Do you see that?
Okay. So to begin with, mental health is anything to do with the well-being of men emotionally, psychologically, and socially. Unfortunately, the traditional norms have fostered men to withhold key information with regards to their own state. So yes, in my practice, I do see a lot of men who tend to suffer in silence because of the fact that they have been pressured to toughen up, man up, and keep it within themselves. So yes, the statistics are true that nearly 17% of adolescents will suffer from a major mental health crisis. But contrary to what we usually expect, women are mostly diagnosed with depression or depressive episodes, but men commit more suicide. And why is that? Because men don't show up.
Exactly, yes. And that's what I saw from my research, is that men and women will go through the same challenges, yes, but men are less likely to seek help. And that is pushing up the suicide statistics. Absolutely. Okay. I think we jump straight into it. Why do men feel the need to kind of hold back, that kind of escapist, like I will just focus more on my work, or I will just, manage it myself?
Yes.
What is that drives that difficulty in seeking help?
Yes. So there is this stigma that revolves around men appearing weak. So unfortunately, social media and the 21st century today has fostered this idea in men that you need to appear strong. You're the man of the house. You need to toughen up. Okay, life happens. Move on. So, and to be honest, men are presented with this Pandora box since their childhood that is just been fed with butterflies that include you're a man. I'll say it in Gujarati, tu marad cho, So men are expected, and the only negative emotion that they feel comfortable showing is anger. It's hard to see a man soften up, cry, just say something is wrong, I need help. because men are supposed to appear strong. And again, expectations from people today is a man should be stoic, well built, have a very hard prison kind of personality, and that is why,
Okay. Yeah. And I think now that we actually look at it differently and think about it, those are that's what fuels that perception that men have. I think I'll pick up on anger, because I think that is it is the go-to for men.
Yes.
It's what they tend to hide behind. I'll just show I'm angry and everybody will keep away from me. Everybody will retreat, The man of the house or dad is not in a good mood today, everybody keep away. And that, I think, pushes that withdrawal even more.
Yes.
How do we manage that better?
Okay, so most of the time, anger is a form of catharsis, okay? You have inbuilt emotions, resentments that are not channeled properly. So anger is one of the outlet in which men tend to exhibit. And it is a very harmful mechanism because then it causes dysfunctional families, workplace disputes. So yes, anger is one of the key ways in which men are comfortable in expressing their stress. So you might have a patient or a person who is angry, but deep down, it's just a child that has been through this hiatus of trauma, abuse, facing a midlife crisis, for example. So yes, so anger is unfortunately one of the ways in which men are comfortable in expressing. But we need to change that, to let them know that, listen, it's okay. Let's just talk about it, I can see you're angry right now. Do you want to talk about it, and everything will simmer down.
But is that easily done? For somebody who has been conditioned from a very young age and has probably witnessed that from the previous generation, that, whenever their dad was upset or the men in the family were upset, they would always just lash out or they would be angry. How do we shift that mindset in terms of seek the help, do the talking therapy?
Yes. Yeah. So it all starts from adolescence and childhood. You need to train them that, listen, I'm okay, I'm angry. Will it matter in 5 minutes? If it does, okay, let's just understand that we are angry, we'll talk about it, okay? If it won't matter in 5 minutes, drop it, You need to train them. But for those people who are hard ingrained in their adulthood that I'm angry and this is how I lash out, it's all right to let them know that, listen, this is an unhealthy catharsis mechanism, and the consequences are pretty evident, So I think we need to spread this knowledge that there are better ways of portraying your emotion rather than just being angry.
Okay, yeah. Okay, we will touch on that, on the strategies, on what men can do. But I want us to offshoot to, if that anger is not managed, or if, yes, anger is one of the outlets, what about reliance on substances or specific behaviors? We will localize it to our society and our community in terms of there's a huge reliance on tobacco-based products. Now we see the vaping, we see the parikis, we see all of that. And you will hear everybody say, what? It's to reduce my stress.
Yes.
When I smoke a cigarette, I feel less stressed.
Yes.
And that is causing a dependence. And then it's causing, again, a whole other, all other kind of problems that we have with physical health issues. Yes. How do we tackle that mindset of because the children grow up with that.
Yes.
It is normalized in households. It is something that sometimes looked up upon,
Yes.
So cool to be smoking. Now with the vaping, I know it's a huge problem.
Yes.
How do we shift that mindset that we don't need to rely on substances or even behaviors now with the gaming and the social media?
Yes. So this phenomenon is what we call escapism, okay? People tend to, find relief temporarily in substances gaming or certain lifestyle changes which are unhealthy, which reminds me of a story by a songwriter named John Randall, who went through a midlife crisis and went through a divorce. So he composed a song and he told his friend, hey man, from time and time again, you gotta put that bottle to your head and pull the trigger. Okay? So that means he resorted to alcohol. And what that did was steamroll him into further depression. And so yes, seeking relief through substances is it's a form of what we call a cognitive dissonance, meaning it's bad, but you try to rationalize it. I know cigarette's bad, but I'll still smoke it because I need relief. There are better ways of de-stressing, okay? Meditation. You could release that energy in the gym, okay? You could attend seminars, you could, most importantly, talk to a therapist, okay? So there are better ways. I mean, like, in a nutshell, turning to alcohol, tobacco, cigarette, what happens when you're diagnosed with cancer? So you're dealing with two stresses now. What originally stressed you, and now you're dealing with cancer. Or now you're dealing with lung diseases, you see? So yes, you'll try and rationalize substance use as a means of escapism, but just know that there are healthier alternatives, Yes, you do not need to add newer problems to an already existing problem, which is dependency.
Absolutely. And I think if we look at it like that, it will force that mindset shift. What are we doing? How are we dealing with? And I think what we call them is those kind of unfavorable coping mechanisms or unhealthy coping mechanisms. Why are we leaning towards something that we know is not good for us, but we still lean on it when we can look for the healthier option and find something that's going to be better for us? And I think you say it absolutely right. You're adding another problem on top of your existing problem. So you're really not helping the situation. Okay, wonderful. Okay. I would like us to shift off onto, personal experiences or what you've seen in the clinic in terms of how people come in and how they've been dealing with their mental health challenges, and specifically the men, and then what you kind of advise them to do.
Yes, yeah. So before I dive into that, with regards to men not seeking mental health, there was a TED Talk I was listening to, and the speaker was talking about the problems women face. Okay? So this man stood up and he said, every woman in my life has been extremely hard on me than any man. My wife and daughter would rather see me die on my white horse than fall off. No man has ever told me to man up, but plenty of women did. Okay? But where did the women learn it from? From the men themselves. That's the tragic irony, see? So, mental health in men is an issue that is contributed by both genders, okay? So, coming to the issues that I've seen in my clinic. So, I've seen a lot of patients that come in with prescription drugs, some Xanax, you have some anxiolytics. Patients have been prescribed with antidepressants just for feeling sad, okay? You've had a patient that's facing a midlife crisis, diving into fatherhood, some financial problems, and he comes in with prescription drugs and he becomes dependent on them, when the solution could have been as simple as asking them, are you okay? Do you need to talk, So there's a case of a patient, Dane Jones, I'll not name him, who lost his father to mouth cancer. And for years and years, this person carried the guilt of not being able to save him. And true story, this patient spiraled out of control and regressed into a lifestyle of sadness and social withdrawal completely, to the point that it affected his immediate family, his immediate surrounding. And he had some doctors want to prescribe antidepressants, bupropion and all that. When presented with such a case, I just had this patient next to me and is very coherent, smart, and just asking him that, are you okay? What do you need to talk about? And he had an outburst of emotions, you see. So, and unfortunately, this patient was already being managed with antidepressants, like the patient was prescribed with antidepressants. So again, grief management had to take place, and with the right channels, that person made it out. He made it out, and there are key steps into managing his grief, which we counsel them, and he made it, and he doesn't need to rely on medications for the rest of his life, which serve as nothing but a band-aid fix. Yes.
Okay. So I think there's a lot of, and I think we will touch on the grief management and how men deal with grief. I mean, it's something everybody goes through. Do men find it difficult to show emotion when they lose a loved one, especially a significant person?
Yes.
That regret or the guilt that eats up at them, to cry or to show that emotion when you lose somebody, is that something that is extremely difficult for men to do?
Yes, it is, because of the fact that they have this contorted belief that they need to appear strong. And in my time practicing in the emergency department, I've seen families that directly just tell the man, who happens to be either a son, a husband, or a father, that it's not fit for you to cry. And who's going to be there for the women? Okay? They say that, and unfortunately with our traditional beliefs, and I'll phrase it in Gujarati, ke tu rare che, mayat ne aziyat pare che, which is a very distorted way of thinking. In fact, and because of that, men bottle up that negative energy, that emotions, which then tend to release in one way or the other, which is harmful for either himself or the immediate family. So yes, it's been extremely difficult. What would I do? What do I do in my practice if I see someone crying? I just hand him a box of tissues. I say, it's okay, cry. You deserve to cry. I mean, it's your time.
Yeah. Agreed. Just allowing them that space.
Yes.
And I always say our bodies have been designed that way.
Yes.
We have the feature to cry. It's God-given. Yes. So there's nothing wrong or there's nothing shameful about crying. And
yes,
if it was something that was shameful for men wouldn't have the mechanism of crying, right? So I think just embracing the fact that we have this as our mechanisms in the way our bodies have been designed to allow ourselves that release. Crying is a great way to release pent-up emotions. And I think just seeing it differently, allowing ourselves to be human in every situation. And everybody passes through grief. So it will be so wonderful if people know how to manage it, because it is a guaranteed. You will, that's how the world works. So you will go through the grief process at some point and you will lose your loved ones. How do you manage it? And how do you manage it in a way that allows you to grieve and go through the grief processes and then have that level of acceptance that comes at the end of the grief stages? Yeah.
Yes. So I tell them that number one, and with regards to the patient who dealt with grief of losing his dad, he felt better after crying. Okay. And I gave him the space to cry as much as he wants, and then he could simmer down and then we could talk. So what I tell them that it's okay to cry, it's okay. It's harmful if you do not acknowledge your emotion. If you live in denial, that no, it's okay, I'm all right, and that's not okay. It's okay to feel human. It's okay to cry. It's okay to feel sad for a life-changing event that takes place, okay? But there are some key steps which I tell anyone dealing with grief, okay? Number one, it's just cry as much as you want, but use certain guidelines to help you cry. Number one, avoid something we call counterfactual thinking. Do not go into the what ifs. What if I had done this? What if I had taken this route? what if we had diagnosed him early? This is what he was lingering on, that what if I had diagnosed my father a little bit earlier, or what if the treatment would have taken place in a better hospital? So I tell them, no, avoid counterfactual thinking. What's done is done, okay? What's happened in the past does not necessarily mean it's going to happen in the future. That's number one. Number two, feel the connection with them, but don't anchor into their memories, okay? Rather, feel them in the current space and time that you are missing them. Because our brain is hardwired to protect us. It tends to project expectations of this person that was, brain wants to protect us from hurt. So it tries to connect the dots. And that's why whenever people hear the sad news that their father or someone has died, they want to deny it. No, it can't happen. It cannot. So yes, counterfactual thinking and feeling them in current space and time, and not anchoring yourselves in their previous memories. And do not turn into escapism ever to deal with grief.
Wow, those are great tips. And I think just looking at it like that has really made me realize that, sometimes we tend to fall into those holes or into that. And I think the what ifs and the questioning and the bargaining that we end up doing, we don't realize who are we doing it with? We're just doing it in our own mind. And it really eats up at us and pushes that acceptance a little further away. And by the time we get to that acceptance, we have done or started relying on so many other things in that process. So just kind of looking at it a bit differently, allowing ourselves to feel and not falling into those traps of the questioning and the bargaining case. Yeah. So Dr. Irfan, I think we can narrow down the main causes of mental health challenges for men to be work stress, that leads to burnout. Finances is huge. It's possibly top on the list. Physical health concerns and relationships. And that's relationships in any context. What can the men do? What kind of coping mechanisms or strategies can you advise or suggest to our viewers today in terms of managing that? Because I don't think we can run away from the stress. It's part and parcel of our lives. How do we cope better? How do we cope so that we don't fall so deep into mental health disorders?
So coping mechanisms is a jargon for people that they can't understand. So it's something we turn to lessen the hurt. Simple. In simple language, it's something we turn to that lessens the hurt. It can either be automatic, you stub your toe, you curse, okay? Or it can be learned, okay? I'm angry, I need to calm down. So coping mechanisms can be either healthy or unhealthy. So as far as I'm concerned, there are 4 coping mechanisms. We have the appraisal coping mechanism, we have the problem-focused coping mechanism, we have the emotion-focused coping mechanism, and we have the occupation-focused coping mechanism. Something that really caught my eye is the first one, the appraisal-focused coping mechanism that wants to change our way of thinking into being more open-minded. We love to know that we have life figured out. We love the fact that we feel we are stable, and the moment our paradigm or our worldview is challenged, it can be extremely stressful. You get a bad breakup text, you don't want to look at the phone. You hear the death of a loved one and you just deny it exists in the first place. So, and a lot of brainwashed individuals tend to have a very closed mindset in which they would never want their worldviews ever challenged. So appraisal-focused coping mechanisms tells us to be more open-minded, to not put the fingers in our ear, and rather accept, views and mindsets from people into either strengthening our own beliefs or allowing us to change, because the truth will set you free. Does it mean that you're going to listen to dissenting voices that are just screaming at your face without any factual backing? No, not necessarily. It all come. You can either conform to their beliefs, or you could stick with your own, because it just further strengthens yours, because it just comes down to what's the truth, what really matters, So being more open-minded. The second coping mechanism is problem-focused coping mechanism, that life presents to you with problems. I can use this problem either as an opportunity to test my mettle, opportunity to grow, opportunity to see if I can endure if things can't be changed. Okay? Most innovations by mankind come through hardships. So if there's a problem I'm facing at home, it's a chance for me to pivot, to change my course into something. Okay, this doesn't work. What if this worked? So I have two choices. Either I can say I got fired from work, and men face this issue, okay? You get fired from your job. You have two options. You can either, number one, go down the road of self-loathing and ruminate on what was there, or you could say, okay, I don't have a job, I better start looking elsewhere. I better start applying 10-15 places. So it reminds me of the book I've read by Who Moved My Cheese. So we are all stuck in this rat race, chasing the cheese, chasing the proverbial cheese. But the moment the cheese is moved, we sit and we start crying that the cheese is gone. Or we could start looking for new cheese, So we are stuck in this life race, and the moment we are redirected, that's a problem for us. So I do not call it more problems, I rather call it redirection. So it's a chance for you to use that as an opportunity to go. The third one is emotion-focused coping mechanism, where you could, so something, a concept we use in cognitive behavioral therapy, that is restructuring your thought process. You have children at home that are making a mess. I could either get angry, or I could say, well, putting it into perspective, when I was a child, I broke windows. Or I could use this as an opportunity to bond with my kids. Yeah, so channeling your emotions, and this is where catharsis comes. Some people punch the punching bag, punch the wall, scream into the pillow. As long as it doesn't harm others, it's fine. It's okay to release. And the last one being occupation-focused coping mechanism. There are certain lifestyles that are causing you stress. Change it. Simple. It's as simple as said, eating a cupcake is bad, it's going to make you fat. Stop eating a cupcake.
Easier said than done.
Truly. Yes.
Okay. Because I think there's great takeaways from there, and great ways where you can kind of manage it for yourself, because it's very much individualistic, but I think you need to remember that sometimes you need the support, and the support is available to you. It's hard to do some of these things that you've said. It's kind of be consistent and channel your energies towards that. And sometimes that little bit of support around you just helps get you into that momentum. And I think a lot of the things that you've said are kind of lifestyle changes, mindset changes, where it's something that you now have to create for yourself.
Yes.
And want to continue. And I love the growth, right? Redirecting, pivoting, seeing it differently, and allowing yourself to grow from the challenge that you're facing, rather than allowing the challenge to pull you down.
Yes.
I think life without challenges is not possible. It can never be so smooth. It cannot be smooth. It's always going to be up and down. How you manage the ups and the downs is key. So with emotional coping mechanisms, does that include things like meditation and journaling and, things where you're reframing the thoughts, so you're using those kind of outlets,
yes,
to manage your thoughts?
Yes, absolutely. So, journaling, positive self-affirmations, meditation, listening to Zen music, listening to some soothing soundtracks can be a way to better channel your emotions, yes. Coupled with lifestyle changes, I think it should bring a huge impact. So that being, for example, smoking cessation, and it's very important. And And I will reiterate my point, being that smoking does add to your stress. It does not relieve your stress. You're feeling sad? Take a book, write down your emotions. You're feeling angry? Write down your emotions. Write down how you're feeling. You are over-encumbered with problems? List your problems down. It will be much more easier for you to visualize a game plan into sorting them out. Yes, you could do that in a peaceful environment where you're just surrounded by nature. You could take a walk. We are busy in this rat race, and this is a very noisy part of town. Most of us live in town. So take a walk. Just go and sit by the beach. Do not talk to anyone. Just dive into your thoughts. Just meditate. Just breathe. Just listen to yourself breathing. These are better ways of handling your emotions. So what you do is it becomes habitual. In the future, instead of being a person that punches the wall and curses at people, you automatically start breathing. You automatically pull out your diary and start journaling.
Yeah. So I think it's learning how to unlearn what you know and kind of relearn the more healthier ways to manage. And I think the habit, I will pick on that. It needs to become a habit, and it can only become a habit if you're consistent with it.
Yes.
And that's when you see the results of things like journaling and deep breathing and meditation, is if you're consistent with it. Yes, it's wonderful when you do it once, but the long-term effect of that is when you're consistent with it, because you're learning how to manage a lot better with your emotional regulation. And I do say these days, journaling doesn't have to be written. We're so used to our phones. You could be anywhere. You feel our phones are always with us.
Yes.
Release that emotion onto a note and just allow it to leave you, so that it doesn't continue eating at you. And I agree 100% with the mental clarity that you get when you put things down on paper. And it's so much easier to decipher the challenge that you have and the problem that you have, and to find the solution, because you can visualize it. It's tangible now, rather than when it's in your head and everything is being associated back to that challenge or that problem, when even it's not really associated with. So that mental clarity, that just writing things down, allowing ourselves we're so always like zoomed in. Now zoom out, see it in a different perspective, see it as the bigger picture, and allow that process to happen.
Yes. So there's a word salad in your head, there's a spaghetti. So you pull the strings one at a time and note them down in paper. It's much more easier for you to visualize and develop a plan to.
Yeah. Dr. Irfan, there is one demographic I'd like us to discuss, and that is our youth. So the boys specifically. They have a lot of stress. There's academic stress, there's social media pressures, there's family obligations, there is the shift from boy to man, so in terms of puberty and growing up. What have you seen in terms of how they manage stress and how they manage mental health challenges, and what do they result to in terms of management of all that stress that they go through?
Yeah. So I've seen cases ranging from preteens up to adolescents that deal with stresses related to academia and real life, and even those from dysfunctional family backgrounds. So a lot of children that I've seen, they resort to deviant sexual practices. I've had adolescents that turn to substance use, particularly weed, marijuana, smoking, or some of them start chewing tobacco. The other ways in which they employ managing the stress, listening to very, very loud music. Yes, they plug in their headphones and they're just waking up with music, going to sleep with music, And a few nerdy individuals turn to gaming. They find gaming as an escape from a very harsh and a brutal reality. For those, there are select populations that have resorted to healthier ways of dealing with their stress. Hitting the gym, for example, which is a beautiful way of managing the stress. I've had students that have contacted their counselors or their head teachers that, I'm not okay, I'm dealing with stress. And rightly so, some of them have called the time out. I've had kids that just decided to take a break from school to de-stress, to strategize, and then go back again. So,
okay, that's interesting in terms of having that flexibility.
yes,
it's a difficult time. We acknowledge it's a difficult time, and we're here to support you and to revisit the scenario and see how best we can help. And I think that's really important in terms of that wholesome development for the child. I think with the schools and with the adults, the parents, family members who are able to identify, if the child is not able to vocalize, to just be like, okay, there is something going on here. How do we provide the support? And taking the break, I think that's really important. And it's not something that we will see very often in terms of, oh my God, no, how can you do that? They will fall behind, they will lose out, etc., etc. We tend to always focus on that.
yes.
So when we reshift the focus onto the person or the child or the teenager who is struggling, we're not going to manage them right now and provide the support that they need. What are we doing for them in their future?
Yes.
If we're going to just push them, no, you just need to go to school and you need to work hard, etc., 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 we're actually damaging or causing more damage.
Yes.
So it's just being a lot more mindful, a lot more observant, and a lot more supportive in what we can do for people who are struggling. And I think this goes across the board. If it's boys, it's girls, it's men, it's women. Support each other.
Yes.
Be aware, recognize that they're struggling and remove that judgment out of it. I think that stigma and the judgment really holds people back from seeking help.
Yes.
And they struggle in silence and they resort to, unhealthy coping mechanisms. And then it's so much harder to get them out of it. So just a shift in our perspectives, I think, is really, really important.
Yeah. You find yourself, with a friend that has suddenly disappeared from the limelight, give him a call, ask him, how is he doing? I tell my parents, that the kids are exposed to very stringent and vigorous timetables, madrasa, tuition, school. It's very easy to burn out. Your child will not be a failure in life if he misses like a couple of days in school, you need to take a break. So yeah. And do not worry about talking about it, do not worry that you will be perceived as weak. In fact, a man that opens up with his emotions is extremely strong.
I agree.
Because he's fighting the stigma.
100%. Thank you for saying that. I think that whole man up,
Yes.
is, we need to turn that upside down.
Yes.
We need to say, I'm seeking the help so that I can show up for the people who matter in my life. If I'm going to let my mental health challenge or disorder consume me, how are you helping the people who matter the most to you? Okay. And by vocalizing, by manning up in that way, you're showing that masculinity that you have, that I can't be there 100% all the time. It's not possible. I need some help, and we are here to support you, and you can be there for the people who matter. And I think that's absolutely spot on in terms of
the very people we turn to on social media as appearing very strong and stoic. These are people that deal with struggles. I mean, like the fact that suicide in men is apparent because we see influencers committing suicide, we see celebrities committing suicide. They appear very happy on social media, but deep down they're struggling. So do not buy into that. It's okay to cry. It's okay to feel sad. It's okay to reach out. You should reach out.
Yeah, and I think, and I've said this prior, that a lot happens behind that.
Yes.
That small box on Instagram or the filters or all of that. And the suicide rate is 4 men to 1 woman. And that's significant. That's a world statistic. And it is higher in Africa because of the lack of support, the lack of awareness, which is what we're working on. It has improved. But in terms of support in the hospitals, in terms of mental health nurses, in terms of doctors, psychologists, psychiatrists, the Africa statistic on suicide is significantly higher than the world statistic here because we don't seek the help. We don't think we need the help, or we are afraid to look for the help. So it really has a long-term impact.
Yeah.
And from a paper I was reading that was published by the Ministry of Health, one of the causes that they ranked very high for mental health challenges or disorders is accidents.
Yes.
And I think accidents is being used very loosely here, and I think they mean a lot of other things.
Yes.
What is your take on that? Do you think that has a significant impact?
Yes, absolutely, because the person involved in the accident nearly loses his life, deals with trauma, PTSD from that event that was either life-altering. He deals with disabilities, and that's a stress on himself. Family members who tend to care for patients who are debilitated is also an issue. Talking about accidents, they might have also meant sicknesses, illnesses which are terminal. So how many community members do we have that are caring for patients with neurological deficits, stroke patients, Alzheimer's disease, dementia, Parkinson's disease, okay? The patient is suffering, and so is the caretaker. And caretaker burnout is extremely common, okay? So it's okay to reach out. So, so the government was spot on. Maybe they just enveloped all this under accidents. So yes.
Yeah, I think so too. And picking up on the carers or the primary carers and their burnout and their stress levels. And I think there's a lot of shame or for the carer to reach out for help, because we have to help this person who is in a more difficult state. How can I burn out? If I'm not going to be there to help, then who's going to do it? And I just have to push along, and I just have to push along. And it's just to understand that you're a human being. You're allowed to feel what you're feeling. You're allowed to be like this is getting a bit difficult, or it's getting a bit tiring, and seek the help. However, I think we find that very difficult to do, to seek support and to seek help. And the primary carers for somebody who's elderly or sick have significantly high burnout rates and very, very high stress levels, because there's a lot that the other person is dependent on them for. And it makes things a lot more harder when you cannot find time for yourself.
Sure.
Yeah, it's just, again, it comes back down to balance. It comes back down to wholesome living and being there for each other.
Yeah. Detaxing and mentally taxing do not carry the burden of being stressed alone. Share it, dissipate the energy. So reach out, talk to your friend, confide into someone you trust, talk to a therapist. We need to normalize now this issue. We need to normalize the concept that, hey, I'm not okay, I have contacted a therapist. Hey, I'm not all right, I need a counselor, I need a coach. It's completely fine. When you're sick, you need to see a doctor. Now you need to see a therapist who is a doctor of your mental health. So yes, it needs to be something that is routine.
Exactly. And I think that's something that we're working towards in terms of destigmatizing and normalizing, and also to a certain degree sensitizing the audience and the people. I know they're doing it now in schools, where there's always a school counselor on campus every day. They have classes that they're running. I don't know. I don't think this happens in the local schools, but I know with a lot of international kind of curriculums, there is a counselor available. So the children are growing up with that normalization that there's somebody there that we need to go and talk to if we're having a bad day. Or they're running the classes and they're educating, creating the awareness on emotions and how you feel in situations. Where they use a lot of the emojis. I know my youngest daughter, they use a lot of emojis. So angry and when we're sad and we're happy. And then they're connecting the emotions to that. Yeah.
Yes, absolutely. Yeah.
Okay, Dr. Irfan, I think there's a lot we have discussed today. What can you leave our viewers with in terms of one key takeaway or kind of a summary of what we have discussed, how to manage better? And I would say it again, seek help, seek support. It's there, it's available.
Yes. So know that life will present to you challenges. It's a roller coaster of emotions. It's very easy for you to be redirected and be put in very uncomfortable positions. It's okay. It happens. You've been through it before, you will go through it again, and you will make it like you always have. You need to have that mentality. Implement lifestyle change. This is my request to everyone. Stop smoking. Please do not turn to tobacco use. Do not take alcohol. Hit the gym. Work out. You gotta look good to feel good. This is what I tell my patients, okay? Hit the gym. Normalize exercising. Take a walk. Take a break. Make that walk to the park that you've always been promising. Take the walk down the beach that you've always been promising. It's okay to talk about it. Reach out. You're feeling sad? Call your friend. You're feeling sad? Talk to your parents. Talk to your wife. Talk to your spouse. Talk to your husband. It's okay to cry. You're not weak. You're strong. It's alright. It's good to be stoic because, the universe just has everything panned out. Everything's going to happen the way it does. But that does not necessarily mean that, we bear the burden of what's to come. We share it with others. So talk to people. It's okay to cry when you lose someone. It's totally normal. There's nothing like, and I don't believe in the fact that men shouldn't cry during funerals. No. If you cry, so what is crying? It's the love that you want to show that person that doesn't exist anymore, so it's okay. So reach out, normalize talking to a counselor, normalize talking to a therapist, dial in good sleep. Sleep, very important. Very important. Cut down the use of stimulants, caffeine, coffee, and drink plenty of water. Just change your life. Be healthy and talk. Meet up with a friend over tea and just say, hey, I've been through crap and I need someone to talk to. And you'd be surprised how it gets better,
You're able to just offload.
Yes.
Yeah, and I will reiterate, a trusted friend.
Yes.
Somebody who you can confide in and who will be there to support you. Very important. Very important. And I think those are great takeaways. Crying, normalize it. Seeking help, normalize it. Rely on the more favorable coping mechanisms. Release all the frustrations through the gym or physical exercise or movement, which is really, really important. Our lifestyles become so sedentary. We're not designed to just sit. So take that effort to move. Sleep. I am a huge advocate for sleep. Hydration, balanced. I think just really a balanced life. Balanced lifestyle is really, really important. So thank you very much, Dr. Irfan. It has been a wonderful conversation. I think we have managed to break down how men view emotions and mental health and how they want to hide behind their anger and hide behind that macho-ness and ego to a certain degree. But you have really broken it down for us and given us, or our viewers, wonderful coping mechanisms to manage mental health and emotional regulation better. Yes, and men are not weak. I think I'm going to go home with that.
Absolutely.
Yeah, men are not weak for looking for the help that they need. And I think that's really, really important.
Truly.
Yeah. Thank you very much to the listeners and the viewers you've taken time out today to watch or listen to our podcast. I hope you've had key takeaways from our conversation today on how the men in our families and the men themselves can manage their mental health a little bit better. And as we wrap up the series today, my sincere appreciation to all of you, the viewers and the listeners, the 6 amazing guests who have come on to the podcast, who shared their knowledge, shared their expertise and experience, and to the incredible pre- and post-production team here at CareSpace. Asante sana for making the time, and asante sana to all you viewers, and to you, Dr. Irfan. It has been a pleasure. It's been a great conversation. So thank you very much.